If you've ever struggled to lose weight, you might have thought maybe you should use Ozempic. After all, lots of other people are using it and they're getting good results. And that's true. But in this video, I'm going to go through who should not use Ozempic. I'm using my what you need to know before starting Ozempic. I make all my patients go through this before starting Ozempic because I want to make sure that people are informed and making an informed decision. So people that should not be using Ozempic. So I'm going to go through the readiness checklist. So one of the things is if they have a BMI of 27 or higher. So that means that you've worked out your BMI, which is body mass index, and you've gotten 27 or higher. A lot of people want to use Ozempic just to lose those last 5 kilograms. And although BMI is not the overall indicator of health or anything, it's a good guideline. Another thing you can look at is also central obesity. Do you have a lot of fat around your abdomen? Then that is the more dangerous fat. Then maybe you can consider using Ozempic. But people that just have the last little bit to lose should maybe not use Ozempic because it does seem great, but there are lots of risks involved as well. And also maintenance. What are you going to do when you leave it again? So if you just have that little bit of weight, it's not the risk versus benefit. It's maybe more risky to start it than the benefits that you'll get from it. If you also don't have any other known diseases, you don't have insulin resistance, you don't have diabetes, you don't have high blood pressure, and you don't have obesity, your BMI is not even over 27, maybe Ozempic is not for you. And if you don't understand how to use it, it's maybe not for you. For example, if you think you can use any dosage, you're not actually 100% sure how to inject it or where to inject it, yes, you can find out, but you must first find out before you start it. Another one is if you're not able to afford it. At the moment, Ozempic is still quite expensive. I do think it's going to get cheaper as more brands become FDA approved. And so I think that is coming. But the thing is what you want to ask yourself, yes, maybe you can afford it for 3 months, but then after that, what is going to happen? Are you willing to pay the money for the medication every month? Are you able to pay it every month? And remember, medical aids are starting to approve it, but only for people that really qualify. So people that have diabetes and have a very high BMI. So people that aren't in that category, the medical aid won't pay. And I want you to make sure that you're using a verified, safe product. And if you don't really know where it's coming from, maybe you should just take a step back and just find out a bit more. Because currently it's Ozempic and Sakenda and Mounjaro that are FDA approved. Sometimes you get what they call peptides or compounded products. You're not actually 100% sure where they were made and how did they put this product together. Because remember, you can get side effects not necessarily just from the ingredients. So you don't just get it from semaglutide, but from the way that they make the medication. So I know some people have lost weight with that, but we don't know the exact side effects. And I'd be a bit wary before I inject something like that into myself. So if you're going to use a peptide, if you're desperate to use a peptide that's not really, FDA approved, that's maybe you should ask yourself, am I willing to take that risk? And then if you have any medical issues that's going to make it unsafe, like chronic constipation is one of them, because remember, Ozempic delays gastric emptying. So it makes it the food sits longer in your stomach and intestine, which is good for absorption and glucose, but it's not so good if you have chronic gut issues. So that's something to consider. Also, if you have a history of any thyroid cancers, you must also remember maybe Ozempic is not for you. Any pancreas issues, especially pancreatitis, so inflammation or infection of the pancreas, then maybe you should first take a step back. If you have a history of gallstones, it's not totally contraindicated, but remember any weight loss, especially if it's more rapid weight loss, can lead to gallstones. So if you've already got a history of gallstones, maybe you should just be a little bit wary of that. And then also, do you know the side effects? And obviously the first week or so, a lot of people feel nauseous and like they really don't want to eat. But those are the more mild side effects. Obviously, there's bigger risks like gastric paresis, which means that your stomach can't work at all. But the thing is, overall, Ozempic and the FDA-approved medications have very little risk of that, especially if it's used at the right dosage and it's started low and you go up slowly. So not all of a sudden be put on a high dosage. And then have you weighed up the risks and benefits for your situation? If not, wait a bit. First see the risks versus the benefits. And also, are you willing to make lifestyle changes? Remember, it's not a miracle drug, although it's called that. But you also need to change your lifestyle and change what you eat, because it doesn't help. You just eat less and you become like nutrient deficient, like you actually starving your body of real nutrients that it needs. So are you willing to make changes and eat the foods that your body actually needs? Or do you just want to use it and still eat all the cake and drink all the alcohol that you want? Because if that's the case, it's not healthy for you. It sounds obvious, but then maybe you should just reconsider what your goals are. Like if it's just to look good and not be healthy, maybe you should reconsider. And another thing, if you're not willing to do strength training, it's not for you. I'm very, I want to say obsessed, but obsessed is a bad word, but I really emphasize this with patients. You need to start strength training. If you are using Ozempic or any weight loss medication, actually anyone should do strength training, but especially this medication, because I've seen what it can do to muscle loss and bone loss. And once you lose your bones, especially if you're a bit older, obviously not just dissolve, but you get osteoporosis, your bones get weaker. And that's not what you want, because rapid weight loss can sometimes, it's not just the fat that gets lost, it's the muscle and your bone loss. And if you lose your muscle, you're losing your metabolic muscle. It's like, you don't want that. So that's why when you're on this medication, it's really, really, really important to do strength training at least 2 to 3 times a week. And if you understand that you need to probably limit alcohol or know how to use it with alcohol. Some people, because their glucose starts dropping more, if you don't eat while using it and you use alcohol, your glucose levels might drop a lot. And that is not good for you. And then another thing, emotionally, are you ready? Remember, with weight loss, a lot of emotions come out with that, because food is not just food and calories. It's about pleasure. It's about enjoying your food. It's a lot of emotional eating involved. It's you need to also work on your mindset and your emotional health. So it's a journey that you're going to be taking with yourself if you start Ozempic. And then also, if you plan on just using it for 3 months or so, what is your plan? Are you planning on making big lifestyle changes and then sticking to that? Because if you don't make lifestyle changes, once you stop, most people regain all the weight back. And if you've maybe were on a dosage that was a bit too high for you, you've lost muscle as well. So you might even gain more fat than what you started. And remember, the aim is not just to be thin and unhealthy. It's to be strong, look good, be metabolically healthy, have a healthy mindset and a healthy body. And another thing, do you have support? Don't try to do it by yourself. Have people that are supporting you. If you want to hide using Ozempic, maybe it's not the right thing for you, because we need to do it in a healthy way. And if you want to hide it, there's maybe something that you need to work on first. So do you have support? Does your family know that you're using it? Do your friends know that you're using it? I'm not saying you need to pronounce it to the world that you're using Ozempic, but just have support, that the people that need to know, and they're supporting you in doing that. And also, while you're using Ozempic, also use it to understand your body better and know what foods work for you. Don't use Ozempic and then still eat cake for breakfast, or not know exactly what makes your body feel good and what your body needs. So basically, I'm saying use Ozempic, but take a self-exploration as well. And not only in what you eat, your food, but also mentally, your emotional connection with food. It's important. And also have a goal weight. And then when you've reached that, tell yourself, I am enough. Some people reach the goal weight and then they think, let me go more and more. So there is a point. There must be a goal that you want to reach. Whether it be my glucose levels are better now, or my waist circumference is a certain, it's under what it should be. So have certain goals as well. Otherwise, you might just be always striving to go to the next goal, go to the next goal. So I hope I have made it, if you have said yes to most of this checklist, I'll also put the link for the checklist so you can download it for yourself and you can go through it, and not only with yourself, but with your doctor that's prescribing the medication for you. And if you've said yes to most of those and you're ready, then I wish you well. And I'm happy. It's a great tool. And it's amazing what we have at our disposal at the moment. And remember, it's always about not just one thing. It's not just about the injection. It's about overall lifestyle. So I wish you well. And I hope that Ozempic helps. And if it's not for you yet, then remember there's lots of other things that you can try. So, okay.